Good afternoon, and thank you for joining us for our weekly update. I'm very pleased to be joined by Dr. Lawrence Lowe, our Medical Officer of Health here in Peel, Nancy McDonald-Duncan, our Acting Fire Chief and Director of Emergency Management, and Alison Quigley, Senior Vice President, Patient Care Services at Trillium Health Partners. It's been a tough few days for Peel Region. Early last week, the province announced that Peel would be placed in the restrict or the orange level under the new COVID-19 provincial framework. I know that many restaurants, bars, and gyms were ramping up under the assumption they'd be allowed to accommodate upwards of 50 people in their establishments. Then last Friday, the province of Ontario decided to place the region of Peel into the control or the red zone, meaning that restaurants, bars, and gyms would be limited to a total of 10 people in their space at any given time. To all of our small business owners, I'm truly sorry that you were not able to open to the degree that you had anticipated. I've heard from many of you over the past few days who have expressed your frustration, telling me that you felt blindsided by the province's decision, and I completely understand where you're coming from. You have already dealt with so much uncertainty over the last 8 months, and to be told one thing and then suddenly another is not fair to you either. What made things more complicated was that on Saturday, Dr. Lowe made the decision to implement additional measures on top of the provincial ones because of the large uptick in our case numbers. I know there's been a lot of confusion over which measures are legally enforceable and which ones are strong recommendations. And I'll let Dr. Lowe explain those to you in more detail. All of them, however, are aimed at getting the virus under control in our community. I do want to acknowledge that our communication to businesses, residents, and faith-based organizations, both at the city and the regional level, could have been better. While this is a fluid and fast-moving situation, my top priority as mayor is always ensuring everyone in our community understands the decision-making process. I will continue working hard to ensure everyone has clarity on the new measures that have been put in place. I do want to make it very clear, however, that I support both the province's decision to place Peel into the red zone, as well as Dr. Lowe's additional measures. The measures allow us to take a tailored approach to the local realities here on the ground in Peel. And the local reality is that we are seeing widespread transmission throughout our community. Even with the limited reopenings of our restaurants, gyms, and bars, Dr. Lowe explained to us very clearly that we had to counterbalance this with further measures to limit community spread. We have known for too long that restaurants, bars, and gyms were not the main drivers of the virus. What continues to drive our numbers are both small and large social gatherings. The sobering reality is that the region of Peel is in a dire situation. The numbers of COVID-19 cases in Peel have been rising quickly, with an average of 340 new daily COVID-19 cases over the last week and 105 new daily cases here in Mississauga. These are by far the highest numbers we have seen in the region since the onset of the pandemic in March. It was just over a week and a half ago that our case numbers were still averaging 55 new cases per day, so you can see how quickly things changed. Mississauga is now averaging 50 cases per 100,000 population, with a test positivity rate of 6.5%. The Thanksgiving long weekend, along with a recent large workplace outbreak, is part of the reasons for the uptick in Peel. But the reality, as hard as it may be to stomach, is that the virus has been fully unleashed in our community. Dr. Lowe has told me and his team that his team no longer has the ability to contact trace other than the most severe outbreaks. But what concerns me more than the positivity rate or the number of cases per 100,000 is what our hospitals are facing right now. The situation at Brampton's William Osler Hospital is grim. Right now, the hospital is at full capacity in dealing with more than 50 COVID-19 hospitalizations and more than 50 pending cases. Because individuals need to isolate, they're using 113 rooms that would be normally shared by multiple patients, and yet they're using one room per person. That means hospitals are well above capacity, forcing them to send patients to other hospitals across the province to make room for the COVID-19 surge. Elective surgeries are also being cancelled at the hospital. Trillium Health Partners is also dealing with its own surge. It's not quite as bad yet, but they are also in an extremely vulnerable position. Trillium now has dozens of their own COVID-19 hospitalizations and are also at 100% capacity. I was told last night that roughly 700 tests were conducted at Trillium yesterday. 51 were positive for COVID-19. Simply put, the second wave of COVID has hit Peel Region harder than just about anywhere else in Canada. We need to do everything in our power to stop the movement of this virus. If we can't, the reality is that we will see more and more COVID-19 hospitalizations, more patients in the ICU, and eventually more deaths. I really cannot stress enough how serious the situation is. But what also deeply concerns me is that we are now seeing more transmission in our congregate living settings like our long-term care homes. And we know that how dire the situation was in the long-term care facilities during the first wave in the spring. Everyone in our community has to step up right here and right now. I'm urging all residents, business owners, and faith-based organizations in the strongest terms possible to follow the provincial guidelines as well as Dr. Lowe's additional measures and recommendations. Limit all close in-person contact to your immediate household. Postpone that dinner with friends or that get-together you were planning to have with your extended family. All those celebrating Diwali and Bandi Chor Divas in the next few days, please keep it to your immediate family. If you want to celebrate with a larger group, make it virtual, take it online. I know that these are big asks, and I know people are tired and frustrated. I know there's a lot of COVID fatigue right now, but we're in a real crisis, a real turning point right now. People may want to believe that COVID-19 is over, but the truth is, it's ramping up. If we ignore the advice of public health officials, I genuinely fear that we're going to face prolonged restrictions and a larger and longer lockdown. If that happens, there won't be any debate about how many people can eat inside a restaurant, or how many people can attend a place of worship, or how many people you can have over at your home. We will be in total lockdown. I realize that not everything that Dr. Lowe has put forward is legally enforceable, and even the ones that are will prove extremely difficult for us to enforce. But you're on the honor system here, folks. We need you to follow the guidelines. I support all of the recommendations because it signals to everyone in our community that going against the advice of public health is simply unacceptable and it is irresponsible. This is now about lives, not livelihoods. It's about preserving lives in our community, and above all else, that is my #1 priority. I want to take a moment to thank the province for supporting us in our efforts to reduce the impact of the second wave. I know that the Premier and his team realize just how serious the situation is here. Yesterday, the province announced that they would help Peel by immediately establishing new community-based testing centres in our region. And I'm pleased that the province has implemented 2 mobile testing sites in Mississauga and 3 more in Brampton. These locations have limited walk-in availability for those who can't book an appointment online or by phone. The province is also providing up to 70 case and contact management staff to support Peel, and investing $42 million for up to 234 new patient beds at 3 of our hospitals and other healthcare facilities. William Osler Health Systems will be receiving up to 87 new beds, while Trillium received 141. I want to also thank the federal government for providing funding to Peel Region for a new isolation centre, something that we have been asking for since September. I have heard far too many stories of family members spreading COVID-19 to their loved ones simply because they had nowhere else to self-isolate. I truly hope that this new isolation centre will help make a significant dent in our rates of community transmission. I again urge everybody in Mississauga to limit their in-person contact to just their immediate households and to closely follow the advice of our public health officials. Please be responsible. Please do the right thing for yourself, your family, your neighbours, and the entire community. And now I would like to invite Dr. Lowe up to provide us with his weekly update. Dr. Lowe.
Thank you, Madam Mayor, and good afternoon. As of noon today, Peel Public Health has investigated 6,229 cases of COVID-19 in Mississauga. Of these, 705 are active, 5,287 are resolved, and 237 have passed away. Today, the region of Peel saw its highest number of daily cases reported since the pandemic began, at 458, of which 162 were reported here in Mississauga. I know it is difficult to hear that our cases are rising, along with our test positivity, and that our hospitals are under extreme pressure. I must also clarify, in addition to what Mayor Crombie identified, that Peel Public Health does still continue to contact trace at this time, thanks to the help of health units and the province, 11 other health units across Ontario. But our ability to do so is increasingly challenged, and at some point, it may just be severe outbreaks only. This is why we have brought in enhanced measures on top of the red control zone of the province's framework that are designed to bring the virus under better control across our region as quickly as possible. But to succeed, I need everyone to act. I also need you to know that things are likely to get worse before they get better. That's why it is critical for each of us to take individual action in everything we do and everywhere right now. We need to get COVID-19 under control in Peel. So let's begin by talking about Mississauga's situation. I know that cross-jurisdictional comparisons of the pandemic response can sometimes bring a false sense of security. Think Canada versus the United States, for example. There is nothing magical about COVID-19, though. It spreads from person to person, and if we aren't wise, cities are where it loves to thrive. While other municipalities in the region of Peel might be facing different challenges driven by disparity, we are still seeing significant increases right here in Mississauga. Mississauga's weekly incidence rate stands at 50 per 100,000, which is double the 25 per 100,000 that the WHO and Harvard recommend as the level for strict stay-at-home orders. Brampton hospitals are dealing with COVID-19 surges on top of their usual high volumes, which means that Mississauga area hospitals may be next if patients can't get in there. And I'll repeat again from the numbers that I said earlier. There are now 705 active cases of COVID-19 in Mississauga, where there were just 100 a month ago. So even with the news of a vaccine coming, though I do want to still verify the data myself to be sure, we cannot cruise in Mississauga or throughout Peel. We have to stay the course. And for that reason, I'd like to clarify the measures that I recently issued on Monday. These measures build on the province's framework, which place Peel in the red control category. They consist of instructions, which are enforceable under the Emergency Management and Civil Protection Act, and strong recommendations for which I am relying on each resident to do the right thing. The first instruction, I hope, is easily understood. In any establishment, do not attend or hold wedding receptions from Friday through January 7th, 2021. I also ask from Friday that you do not hold social gatherings of any kind in any establishment. The science and data are clear. These life events have been major drivers of transmission in our community. Because they are often special, there is a lot of pressure to attend, even when you're just a little bit sick. Now, these instructions go against every fiber of my being. I revel in socializing and would never, in a million years, imagine that I would be instructing against them. I guess that's just 2020. My other instructions are to ask banquet halls per the order of the regional chair to close, failing which to operate under specific conditions as outlined in the letter. For gyms, to keep a track of who's attending which group classes to help with contact tracing in the event of an exposure. And for workplaces to encourage employees as much as possible to work from home and to limit essential visitors on their premises. I must state that besides the wedding instruction, which goes through till January 7th, 2021, all of these instructions will be revisited every 2 weeks. So if we can do this right, December holidays might still be in play. My other advice speaks to limiting close contacts with your household and essential supports as much as possible. Also, when attending places of worship and restaurants, and otherwise engaging only in necessary in-person activities outside your homes while following precautions. These are recommendations, and we won't be enforcing them, but we are relying on everyone to do the right thing. peelregion.ca/coronavirus currently has a banner that will take you to all the details on what's an instruction and what's a recommendation. But the key message is simple. To stop spread, we must stop meeting in person. We must reduce our in-person contacts. All of us have activities that we have to do in person. Work, school, healthcare, exercise, buying necessities like groceries and gas. But for the next 2 to 4 weeks, I am asking that we just limit ourselves to those essentials, with the precautions of distancing, masking, and hand washing where we do meet. And for everything else, please postpone or meet virtually. Mississauga's picture can worsen even more quickly if we just act like everything is fine. We must remain laser-focused and reduce our interactions to keep schools open and safe, protect our long-term care homes and hospitals, and ensure that we stay the course until a vaccine is available. So your choices matter. Please, no large gatherings. Stick to your immediate household as much as possible and stick to the precautions if you have to meet anyone else. For those of you who are wondering, by the way, this is how a balanced approach to pandemic response works. When the scale tips towards needing to control COVID, then you need to make adjustments to control COVID. Now is the time to act, and now is the time to flatten our second wave. Thank you, and I'll pass it back to Mayor Crombie.
Thank you, Dr. Lowe. Before I take questions from the media, I'd like to invite Alison Quigley from Trillium Health Partners to say a few words. I invited Alison here because I want everyone in the community to clearly understand the situations our hospitals are facing and what will happen to our hospitals if we don't start taking serious action immediately. Alison, over to you.
Thank you, Dr. Lowe, Madam Mayor. I'm Alison Quigley, Senior Vice President of Patient Care Services at Trillium Health Partners. Thank you for inviting THP to provide some context today about what we're seeing inside of our hospital walls. On behalf of the 12,000 frontline workers at Trillium, I'd first like to thank the community for their support and sacrifice throughout COVID-19. I am grateful as a leader, as a nurse, and as a proud resident of Mississauga. We know this period has been challenging for everyone, and this community has been hit harder than many. Trillium Health Partners has treated one of the highest number of COVID-19 cases in the province. We have been managing the second wave of the pandemic, and have been watching these 3 indicators very closely. 1, the increase in cases. 2, the increase in positivity rates. And 3, the increase in hospitalizations. We've been tracking the positivity rates of tests completed in our assessment centres. We are seeing a 7.9% positivity rate over the last 7 days. To provide context, we like to see this number far below 5%. THP has seen the number of COVID-positive patients in the hospital double over the past week, situation not unlike William Osler. 2 weeks ahead of us, we now have 43 patients with COVID within our walls. 20% of those individuals are in our critical care units, and those who are hospitalized outside the critical care units are very sick. To date, we have had 130 people succumb to COVID-19, and we have had 6 deaths from COVID-19 over the past 10 days. We have seen COVID-positive patients of all ages in our hospital, healthy 50-year-olds, in good shape, pregnant women, grandmothers, grandfathers. There's no standard COVID-19 patient. I was speaking to one of our managers this morning. She runs the COVID unit at our Mississauga hospital site. And we talked about the increase in COVID-19 positive patients and the increase that she's seen with her team over the last 10 days. She told me that she and her staff are taken aback by the spike, and also told me that the patients that they are seeing this time around are younger. She also said that a common refrain from these patients is that they didn't think it would happen to them. What they don't understand also is that when they are admitted into hospital, we are needing to restrict visitors, and so they're not able to see their loved ones, and this causes great strife. It's hard on the patients, it's hard on their families, and it certainly is hard on our frontline healthcare workers. The reality is COVID-19 can affect anyone. While we're seeing these numbers increase in our region, I want to assure you that THP is prepared to respond. We have a plan to manage through this second wave, and we've outlined that in this forum several weeks ago. Our plan includes a commitment to the best infection and prevention, control measures and training, a healthy supply of PPE, increased testing capacity, highly trained and dedicated staff and physicians, and if needed, we have additional beds and spaces. To ensure that individuals can always get the high-quality acute care and life-saving care that they need in their own community, we need the public's health right now. I can't overstate this. To prevent THP from becoming overwhelmed by COVID-19 cases, we strongly urge the community to abide by the direction provided by public health officials, to abide by the counsel provided by our mayor. To reduce the spread of this terrible virus, every little action counts, and we can't do this without you. Together, we can make a difference. Thank you, Madam Mayor.
Thank you, Allison. And with that, we're prepared to take questions.
Madam Mayor, your first question comes from Ashley at Mississauga.
Hi, Ashley.
Ashley, go ahead.
Hi, Mayor Crombie.
Hey, how are you?
I'm good. How are you?
Very well, thank you.
So I know that you had just mentioned, and Dr. Lowe mentioned this too, that COVID is spreading quite a bit throughout Mississauga. So I assume it's spreading quite a bit throughout the entire city. But on the Region of Peel's website, it does show that some areas in Mississauga are definitely a lot more hard hit than others, with neighborhoods like Malton and Cooksville being particularly hard hit. Under the province's new framework, I'm actually wondering if there's ways for Peel Public Health to specifically target these communities and give them, I guess, any additional support that they might need to kind of stop that significant spread from happening in those communities, and then, of course, spreading throughout the city more widely. Is there any kind of new tools that you have that can help address pinpoint support to communities that are really struggling to get some control?
Certainly, Ashley, there are many ways in doing so, and the first one is that there is a new testing assessment site open at Four Corners Health Centre in Malton, which I know is one of the harder hit areas. And why don't I allow Dr. Lowe also to respond on this issue? Thank you for the question, Ashley.
Yes, thank you, Madam Mayor, and thank you, Ashley, for the question. There's two things I would say in respect of this. We continue to work very closely with community partners and also our healthcare partners, Ontario Health, our hospital partners, and certainly our local leaders to try to make sure that harder hit neighborhoods as identified in the map that we have are given the support and resources that they need. But I really want to make very clear, we are now starting to see a picture of widespread community transmission. In very large respects, the geographic map you're looking at really shows just where cases live, but it does not show where they may have acquired the disease. And the reality is, at this point in time, we need everyone in the community, no matter where you are, no matter where you might be going, to really shrink all your activities to the most essential over the next 2 to 4 weeks. And then otherwise, for anything that you have to do, make sure that you're doing it with precautions, because the reality is that the virus is circulating widely at this point in time. Thanks for the question.
Follow-up question?
Thank you. So my follow-up is for Mayor Crombie. I'm also not sure if maybe Dr. Lowe will want to weigh in too, but I actually wanted to ask about workplaces because I know that workplaces have been a really big driver of cases in Peel, and I know that the province announced that over the weekend it sent a number of workers from different ministries out to, I guess, educate businesses in Peel about how to best prevent infection spread. And I think that they said there was a focus on retail and that they visited over 300 places. But I'm wondering if there's a more targeted approach to be proactively inspecting without announcing it, places where you're seeing a lot of spread. Like you mentioned, there was a really big outbreak out of business recently. So is the region able to inspect these workplaces and try to stop spread by maybe, leveling fines when necessary, or helping businesses create more safeguards so that we don't see these huge outbreaks in places like warehouses and processing plants and things like that?
Thank you for the question, Ashley. And yes, that was a manufacturing plant with where the outbreak occurred, and we were able to isolate it and shut it down. I should mention that there are actually 2 new testing sites in Mississauga as well, the Four Corners Community Health Center at Westwood Square, and also the Kingsway Paramedic Station, and that has the drive-through up at 7120 here, Ontario. There are also 3 sites in Brampton and 1 in Etobicoke. I will also share that our bylaw enforcement are out doing blitzes and doing random checks and inspections of different types of business sectors. Certainly they were able to close down 2, what shall we call, lounges last week, as well as a late night speakeasy. So they are certainly going through different sectors and inspecting them. And maybe I'll ask Dr. Lowe to follow up as well.
Yeah. So thank you, Madam Mayor. Thanks, Ashley, for the question. So in fact, Peel Public Health was involved with the multi-ministry inspection blitz that occurred over the weekend. We actually used our data to inform the specific retail facilities that they would be going into. Obviously, that was not announced ahead of time because we did not necessarily want to tip people off that this was occurring. There are more blitzes that are going to be planned. And besides the public blitzes of retail facilities that we had conducted with the ministry, and also I believe municipal bylaw also attended some of these. We do continue to work with the Ministry of Labour to actually target workplaces that are not open to the public but present a high risk just based on our data. The final thing I'll say is that one of the things that I wrote in my recommendations to the Chief Medical Officer of Health is the need to really look at some sort of provincial framework that supports income supports for individuals who are sick or unable to work due to COVID-19 isolation. So something like paid sick days and other protections for workers would go a long way to preventing these in the first instance, because especially in one of the municipalities here in the region of Peel, there is a tendency for people who work in jobs where they cannot work remotely to actually still go into work because even if they have to be isolating or if they're sick, because they're concerned about losing their job or they're concerned that they're not going to have enough money to make rent or to be able to live. And that's where exposures and outbreaks are occurring. So to the extent that that policy mechanism can be brought to bear even temporarily during this pandemic, that would go a long way to incentivizing people who are sick to do the right thing and stay home and self-isolate. Thank you very much for the question.
Next question, please.
Mayor, your next question comes from Vioza at The Pointer. Go ahead.
Welcome.
Hi, Mayor Crombie.
Hi.
Hi. On Facebook, you had called on residents to share information about a Halloween party that allegedly took place in Mississauga. I'm thinking back to a similar incident at a Toronto nightclub over the summer where Toronto Police laid charges under the Emergency Management Act. And I wanted to ask you if the city will be calling on Peel Police to investigate this alleged incident. And for Dr. Lowe, has contact tracing data shown any links to Halloween?
So excellent questions, and yes, Peel Police are investigating, and charges will be laid on said establishment, which allegedly a late night party occurred. And why don't I ask Dr. Lowe to make further comment? Thank you.
Thanks, Vioja, for the question. Contact tracing obviously continues, but I think just on a gross number, just in the last weekend, which represents 2 weeks from Halloween, we have seen an additional surge. I think we are, like I mentioned, 458 cases today. And one thing that I think I had mentioned prior to Halloween was that ideally we did not want to see a Halloween surge on top of a Thanksgiving surge. On the basis of gross numbers, it appears that that may have contributed, and so certainly, it's something that we continue to look into. But the time frame certainly is suspicious for being linked with Halloween. Thank you very much.
Follow?
Yeah. So the focus on Brampton as a hotspot has kind of drawn attention towards that municipality in Peel. But as you noted, Mayor Crombie and Dr. Lowe, the rate among 100,000 residents in Mississauga is at about 50, and our analysis over the last 7 days puts it a little bit higher. Some census tracts, like in Malton, is seeing about 350 cases per 100,000. So I'm just wondering if you're concerned that Peel residents who may be viewing Brampton as the main driver are kind of getting a false sense of security. So Mayor Crombie, could you comment on the importance of leaders highlighting these figures? And to Dr. Lowe, could you speak to the viral picture in Mississauga in the provincial context?
It's an excellent question, because I think for a period of time, Mississaugans were relaxing their following of the guidelines because they thought that the majority of the cases had been occurring in Brampton, but that is not the case. Certainly, they may be a little bit higher than we are in Brampton, but we have 105 new daily cases here in Mississauga, whereas 10 days ago we were averaging 55. So it's terrifying for me that things have grown so quickly, so exponentially. Notwithstanding, we have 340 new daily cases in Peel over the last week. The median age is 39. The highest case rates are between 20 to 29 and also over 80. 66% of cases have been under the age of 50. What else can I share with you? The positivity rates in Peel are 9.4, Mississauga 6.5, Brampton 12.3, Caledon 9.9. William Osler is currently testing at an average about 1,750 to 1,800 people per day. I think it's Trillium Health Partners 1,000 to 1,200 per day. Transmission, 47% of all transmissions are household contacts, 14% through close contact outside the home, 3% workplace outbreaks, and 5% acquired through travel, 22% acquired through unknown exposures. Weddings and other celebrations are also very important drivers, leading to 33 cases in Peel a week ago, and also the large infection that occurred in the workplace. Why don't I allow Dr. Lowe to comment further? Thank you.
Thanks, Madam Mayor, for the opportunity. Thanks, Vioja, for the question. Certainly, the statistics and the metrics that the Mayor has shared are stark, and I've already alluded to this in my remarks at the beginning of this press conference. We cannot afford to be complacent in Mississauga, and frankly in Caledon neither. In just, again, the false sense of security that comes with relative comparisons can often lead people to let down one's guard. The reality is that we are close to seeing similar pictures in all three of our municipalities here, as have been seen in other parts of the world where the virus spins out of control, if we do not take decisive action now. So beyond all the numbers that Madam Mayor shared, I think really the key message at this point in time is limit your close contact to your immediate households as much as possible, your immediate households and essential supports. And for all your other in-person activities beyond your household, make sure that you have to do it, it's an essential activity, and that you're doing it with precautions. Thank you for the question.
Madam Mayor, your final question comes from Steve Cromwell at MississaugaNews.com.
Hi, Steve.
Go ahead.
Hi, Mayor
Steve?
Crombie. Thanks for the update today.
Yes, thank you. Thank you for joining us.
Pleasure. You'd mentioned earlier there's been some issues around the communication to businesses about going into the kind of the red zone, so to speak, on Saturday. Could you kind of take us through kind of why there wasn't more notice given to restaurants and bars around kind of the shifting landscape for Saturday?
Well, as you know, things evolve quickly. And as you also know, there are very limited ways to communicate information to our residents in Peel. You yourself will know we don't have a daily paper. And, as much as I and myself and Mayor Brown can appear and Dr. Lowe appear on CP24, not everyone hears us at the time. So things shifted. I will still share with you that Wednesday and Thursday we thought we were entering the orange zone, and restaurants thought that they would be able to open their restaurants to indoor dining to 50 people capacity, and some of them were sharing with me they thought that wasn't sufficient because they had larger capacities. And then things changed. We had that workplace outbreak, and there was a large uptick in numbers, and suddenly through collaboration with Peel Public Health, Dr. Williams, the Ontario Public Health Officer, the Premier's office, the decision was made that it was safer to move Peel into the red zone. Those are the indices that we met, and we were beginning to communicate that out. But at the same time, since restaurants and gyms were open, Dr. Lowe felt very strongly that we needed to counterbalance in other areas. So if the spread of if the virus was being transmitted through social gatherings and private settings, we needed to address that as well through other measures. And so he very quickly said, well, if there are going to be 10 people inside a restaurant, there should be only 4 to a table. It should be immediate households. In fact, anytime everyone should limit themselves to immediate contact with immediate households only, and go outside for only essential activities such as groceries, pharmaceuticals, gas, banking, etc. And whoever still can, please continue to work from home. Dr. Lowe, why don't I allow you to also respond to that question on how quickly things evolved and how difficult it was to get that message out with a lot of clarity. Thank you.
Yeah, thank you, Madam Mayor, and thanks, Steve, for the question. The only thing I would add to Madam Mayor's analysis is that the picture that changed dramatically this past Thursday was that from a public health perspective, we started receiving over 300 cases consistently. We were starting to see significant case rise that has been driven further by our number today of 458 cases in the region of Peel. And despite the fact that we continue to receive significant assistance from public health units all across the province, from our provincial partners, we're still falling further behind. And as Madam Mayor identified, we're at risk where at some point our contact tracing efforts are no longer going to be effective. So that's one part. In the red zone, you'll see it says if public health capacity is a risk of being overwhelmed. And then the other thing that really tipped the scales, as I'm sure you know, was the significant surge in COVID patients that was seen at William Osler last Thursday that they are still recovering from. And that was just a simple surge on top of what is already a significant amount of activity at a very busy hospital. When your public health unit is receiving contact tracing assistance from all over the province, and one of your local hospitals is transferring patients out to other hospitals across the province, it is clear that your capacity is overwhelmed. So I think that was essentially what tipped the scales very quickly, and it's not something that would have been foreseen necessarily, especially just given the discussion and the patterns that had been seen the 4 to 5 days before. But all that to say, in terms of the broader communication, I think I had made it very clear when the province's new framework was announced that regardless of where we ended up, whether it was orange or red, that there had to be some sort of counterbalance that came down to balance things out. And I'm really grateful that all of our area mayors, our chair, they've supported those measures to make sure that we are addressing those drivers of transmission in our community, because ultimately an unrestricted opening would have been an unmitigated disaster. Thank you for your question.
Actually, a follow-up for you, Dr. Lowe, just on the isolation center. Do you know when it can be expected to be opened, and when Peel Health can kind of use it as a tool to help mitigate cases?
Thanks, Steve, for the question. As you know, we received the happy news yesterday evening that our approval for funding for the centre was accepted by the federal government. We are now working out the specific details. In our application, we had indicated December 1st as a desired date. Given the circumstances of our picture and the fact that the facility is already opened, we will be having conversations with our federal partners to figure out how quickly we can get this up and running. Certainly, hopefully, by December 1st, I think that would be the goal. That would be in 2 weeks' time, recognizing that things do move quickly. But I think it's really great to hear that our application has been received and that we will be receiving a voluntary isolation centre to assist with the household transmission that we see in our region. Thank you very much for the question.
Final question for the day comes from Khalid at My Second Home TV. Go ahead.
You know that certain lounges are like repeat offenders. Can you name and shame, like make a list of name and shame such people? Because it is ridiculous and irresponsible to do something like this, and they know that they are violating and jeopardizing not only the laws, but it's the health.
You know, Khalid, it's an important question you ask. We have taken a decision that we do not name or corporate companies, businesses where outbreaks have occurred. If we do, we may lose their cooperation in helping to contact trace at their establishments. So, this is an issue that has come up at Regional Council. Why we don't name them, and there are certainly privacy issues involved. So I'll just ask Dr. Lowe to comment on that as well as a policy of public health. Thank you.
Thank you.
Thank you, Madam Mayor, and thank you, Khalid, for the question. In any instance, if there is ever a risk to the public due to an exposure or an inability for us to trace all possible contacts in the case of a case investigation, we will always disclose the name of a business. However, if there is no public risk that has been identified, if we complete our case management and our contact tracing, then this becomes a personal health matter. The individuals that are impacted in the course of our investigations are privileging us with their private health information, with their private information, in order to allow us to actually stop spread in the community. And so to the extent that under the Personal Health and Information Protection Act, we are meant to keep that information and their identities protected as much as possible, that is for that reason where if there is no public exposure that has been identified, we do not disclose the location of where the exposure has happened. And it's pretty simple. If the public didn't have access, if the public wasn't at risk, then I think that's the other thing. The other thing that's the reason why we do that. The other thing I would say, Khalid, which is absolutely critical for people to know, a lot of people are focused on trying to know where the cases are happening, where the exposures are happening. If you remember what I've said at the beginning, we are now seeing widespread undifferentiated transmission of the virus in our community, which means it can be anywhere. So this information is even less relevant to all of you, as far as I'm concerned, to all of us. We all need to be taking every precaution with everything, and we need to be limiting our visits outside the home to only the most essential reasons with precautions. It's not important where it's happening anymore, it's happening everywhere. Thanks for the question.
Thank you. If I may, the follow-up also, would it be...
Check your phone.
Sorry about that.
Khalid, go ahead.
Premier Ford pushed for a rapid test at the airport. Where is that right now, and would it be possible to see in the very near time?
To best of my knowledge, Khalid, we're still at the approval stage for those rapid tests. As soon as they are approved, I think at the airport would be the first place they should be used and implemented. Ask Dr. Lowe if he is aware of rapid testing at the airport, and he's going to respond as well. Thank you.
Thank you so much.
Thanks, Khalid. This is a really great question. I'm part of a Greater Toronto Airport Authority discussion around testing at the airport. I know that our partners at the airport are very keen to see this come back. They see it as an opportunity to really try to encourage people to travel again. I must say, obviously, as I say that, there is still a federal recommendation that you do not travel outside of Canada except for essential reasons. But that said, I do know that our airport partners are working with us in public health Health, as well as the Ministry of Health and the province, the Public Health, with Public Health Ontario, the provincial agency, to look at how rapid testing might be used to facilitate arriving passengers in quarantine. There's nothing that has come out of that at this point in time, and naturally, one of the concerns that I would have is how you would do it. So is it, on arrival and then 5 days later to try to shorten the quarantine period, or whatever the case might be? All that to say, the discussions continue, but I think the real important thing to remember that is in the broader piece around prevention, we want to make sure that we're limiting as much as possible our in-person interactions within the community, and to the extent that you can also abide by the federal government's recommendation to not really head anywhere out of Canada, I think that's probably a wise decision at this point in time as well. Thanks, Khalid.
So much.
That concludes our press conference for today. I thank you all for joining me on behalf of Mayor Crombie. Thank you, and have a good day and stay well.
Thank you very much.